GA, it's a state mandated program that the county administers with its own money, and the maximum that you can receive, it's not really a benefit, right? It's a loan, because if you ever get your SSI, you have to pay it all back. And they've reduced it in many different ways, from 336 to 105 to as low as 19 if you take a CHAS bet. The amount of personal property you're allowed to have. You can have one car, you can have a life insurance policy that you can't cash out, furniture and clothing, and tools of the trade. You can't have anything else, any other kind of personal property. Next slide. So as you all know, in November of '09, just this last November, the counties chose an arbitrary number of $40 a month to start reducing everybody's grant if you don't have Medi-Cal. They didn't base that number on anything. They just wanted to get to a certain amount of savings, and they divided that number by the amount of people who don't have health insurance and reduced everyone by $40. It's totally arbitrary. That $40 disregard, that deduction, should not apply to you if you have Medi-Cal, if you have health insurance. And we argue that if you haven't utilized a county clinic or a county hospital in that month, then they shouldn't take that $40 for you, and we think you should request a hearing. The county can't rob you of $40 for something that you didn't do. So you have a hearing request in your packet, and you can fill it out and say, I disagree with the county's decision to take my $40 because I didn't use county medical services this month, and get your $40 back. And when you go to the hearing office, Andy and I and about 7 other attorneys are going to be there manning the hearing office for 7 days a week in April, May, and June, helping whoever is there who has requested a hearing fill out their position statement and argue with the county. So we'll have free legal representation. We encourage you to fill out the hearing requests because we will help you when you get to the hearing. So that's the $40 deduction. The next one, and the crazy one, is that they penalize people for living with other people. They penalize you for having a roommate. If you have one roommate, they reduce it by 15. If you have 2, they reduce it by 20. If you have 3 or more, they reduce your grant by 25%. So if they are doing this to you, or if they're doing it to someone you know, tell them to file a hearing request. When all else fails, you have no penalty for filing this thing. If you file it and you don't show up, there's no penalty. They can't cut you off, and they don't do anything to you for doing it. So this is the big thing. The time limits do not apply to people who are not classified as employable. If you are unemployable, and that's a very, very loose definition, then you do not have to be cut off on April 1. All you have to do is have this form filled out. It's in your packets. It's on the top of them. It looks like this. I don't know if everyone can see it. On the front, it says Alameda County Social Services Agency at the very top. At the very bottom, it says Form 90-2. The next page says employable, employable with some restrictions, and unemployable. You can have a doctor or any medical licensed professional. It can be a social worker, a nurse practitioner. It could be anyone that has any kind of initial after their name saying they've got some kind of license. It does not have to be a medical doctor. Sign and check this form. You will keep your GA year-round. If you don't have a doctor, the county is providing everybody with a free assessment. If you have to ask your worker, and you should file a hearing request because it's taking about 2 weeks to get an appointment with the doctor. So file the hearing request, ask to see a doctor, fill out this form, and then you'll stay on GA. To be classified as unemployable, all you have to do is turn in this form. If you can't get this form before April 1, file a hearing request and we will represent you for free. Next slide.
May I ask a question?
Yeah, of course. Oh, please ask questions.
Is there any advantage or disadvantage for seeing like one of their doctors or psychiatrists compared to a private one?
If you go, that's a very good question he asks, is what if you go to their doctor and they say that you are able to work? Is that basically, you can then file a hearing request and we will find a doctor somewhere. If you use the county's doctors first and it doesn't work, we're trying to get together a pool of doctors who will work for free 1 day a week and see as many GE recipients as possible. Applying for SSI, you should definitely file a hearing request. The director of the agency has told us that people who are applying for SSI aren't going to be cut off. Now, the workers haven't gotten that yet, but when you file a hearing request and we get you to a hearing, we're going to have like these prepared statements of all the things that the director of the agency has said should apply to everybody. and people who apply for SSI or who have an application pending aren't supposed to be affected by this cut. County disability is not the same definition as federal disability. GA disability is not like SSI disability. It's a whole different ballgame. Proving disability with the county is turning in this form that's signed by some doctor that says you have are unemployable. Proving disability for SSI can take 2 years, and a bunch of, like, that's why you can hire an attorney to do it most of the time. Next slide. The packet of materials that I've given you are the hearing request, the Form 90-2. If anything that I've said has been unclear, then this packet from Bay Area Legal Aid that says, how do I stop cuts to my GA grant. It's about 14 pages, but it's really, really, really explanatory. It explains everything that I said in much greater detail. And if you want to train other people or tell other people about how they can stay on, this will really help them. And so you can read it and help other people. We also included a position statement template, which is what we'll use on the day of the hearings. We're going to help people fill these out so that they can go into the hearing officer, and the hearing officer will say, why do you disagree with the county? And the person who's appealing will have to say, this is why I'm appealing, I disagree with the county. And they'll give the position statement to the hearing officer so that there won't be any mistake or they can't trick you into saying something you don't really want. And those are the reasons why people are appealing, either due to the 3-month time limit, due to the medical care cost deduction, the shared housing deduction, the reduction to the basic needs grant, or appealing the determination of whether or not you're employable or not. The last reason you can appeal, which is on the position statement template, it's on the second page. If they send you a notice of action that they're going to cut you off, and that notice of action doesn't have the reason why they're cutting you off, or doesn't have the law for the reason that they're cutting you off, or doesn't explain that you can get aid paid pending, or doesn't even have like your name on it, or the wrong name, or the wrong address. Those are all reasons that you can request a hearing. They have to give you adequate notice. It's in the Constitution that you get a due process right to this stuff, and so you should be able to appeal. And even if you can keep your GA for 1 more month for that reason, that's 1 more month that you got to keep it. Next slide. On April 1st, I'm going to train 30 attorneys at Alameda County Bar Association's Volunteer Legal Service Provider Program. And those 30 attorneys are going to be manning or stationed in the hearing office in April, May, and June. And the hearing office is out at Edgewater Drive. It's pretty hard to get to. And they're going to be supervised by attorneys from this coalition. And you'll also be working with the law students that we've trained for this as well. If you give me a call if you have any questions at all about GA or how to apply or what's going to happen on the day of your hearing. Our agency and BOSS and other agencies are committed 100% to representing as many people as we can and to help as many people as we can deal with this crisis.